Hi, I'm Leah Fitzgerald. Welcome to 15 Minutes. Tonight, our first story here for you is on two things you may not expect to see together: sexuality and aging. Usually associated with youth, health, and fertility, sexuality is not often seen in conjunction with the older population. Sexuality, in its most textbook definition, is defined by the World Health Organization as a central aspect of being human and includes things such as sex, gender identities and roles, sexual orientation, and reproduction, among others. Even more, we as humans experience and express our sexuality via thoughts, fantasies, and often, most importantly, our relationship with others, among other things. Sexuality, just like the process of aging, is complex. Many different factors go into influencing a person's sexuality. These could be biological, psychological, social, religious, or economic, to name a few. So the biological and psychological aspects of aging most definitely affect a person's sexuality, but it does not erase it. According to its very definition, human sexuality is central to human beings throughout our lives and does not stop at a certain age. Throughout this program today, we will talk to experts in the field of medicine and gather the thoughts of those who can speak personally on the matter. This in-depth report will include the pertinent issues regarding sexuality and aging, and what it all means, with the help of some of the brightest minds from organizations like the National Institute of Aging. From there, we will talk to you about the key players in the issue and the differing views on the matter. Stick around with us to delve in this seemingly taboo, sometimes uncomfortable, but very important topic. Kara, I turn now to you to start the report.
Thanks, Leah. Sexuality and aging should not be seen as two separate ideas. However, this topic raises a lot of issues, from implicit biases, which prevents this population from receiving care they need, to barriers the older population face. For a closer look, we brought in a couple in their 60s and a nurse practitioner to give insight and hopefully education for us all about how sexuality is not something you age out of. With us today is Janice and Josie Smith. They have been sexually active for 45 years and volunteered for this segment to establish a well-needed dialogue regarding this topic. And this is Christina Palmer. She is a nurse practitioner. Christina specializes in working with the adult gerontology population. Thank you both for coming. Christina, what can you tell us about sexuality and the aging population?
Hey, Kara, thanks for having me on today. The first thing I want to tell you about sexuality and the aging population is that it is an important topic. Now that the audience knows what sexuality is, let me talk to you about some of the pertinent issues men and women face in regard to their sexuality as they age. Physically, men and women have changes that may become barriers to expressing their sexuality, though this does not mean that they are not normal. Women experience decreased vaginal lubrication, atrophy of the bladder, thinning of the vaginal mucosa, decreased estrogen levels, reduced elasticity and muscle tone, a decrease in vaginal length and width, loss of vulvar tissue, and a decrease in the size of the clitoris. Men, on the other hand, have testosterone levels that gradually decline, and a decline in excitement, plateau, orgasm, and resolution. More time is required for penile stimulation to obtain and maintain a sufficient erection. Their orgasms become weaker with shorter intervals. There's also a reduction of semen volume. In the resolution stage, there is a prolongation in the time between erections, and then longer periods of stimulation are needed to achieve an erection and to climax. To compound the matter, illnesses such as arthritis, diabetes, heart disease, depression, and incontinence can impact sexuality, and that's just one of the many. To list a few more barriers, there are disabilities such as post-stroke residual weakness or paralysis, surgeries such as a hysterectomy or mastectomy, or for men, a prostatectomy. Medications such as things for hypertension, depression, among many others, can cause issues for both men and women sexually, and nonchalance towards STIs and STDs as well. Super important for me to underline this, Kara, but age does not protect anyone from sexually transmitted diseases. And then with those problems that I've just discussed with you, a person may have a negative associated body image and perception due to physical changes, such as decreased muscle tone and decreased elasticity of the skin. The elderly may worry that their partners no longer find them sexually attractive. Going beyond the physicality of the issue, one must discuss the attitudes towards sexuality and aging. In a really well-done article that I have to suggest by Still, Mock, Schreier, and Elbach, they report that a more positive attitude towards aging can result in a higher reported quality of sex. Also, it may negatively impact a person's attitude towards having sex if they're perimenopausal and believe coitus is only for procreation purposes. Sexuality can totally be impacted by just life itself too, Kara. Life stressors present that may inhibit the ability to relax and engage in sexual behaviors such as career, finances, life stressors, physical or mental fatigue, overindulgence in food and alcohol, lack of a partner, and sexual performance issues. Sexuality can be an especially hard topic when there's a loss of a spouse as well. I brought here for you guys a clip of one of my nursing students and her firsthand thoughts on the topic, and I believe that it will reveal a lot.
Hi, my name is Mia Ham. I'm a sophomore nursing student here at UNC. And what do I think about sexuality and aging? Honestly, I think it's not really a huge issue for them, for that population. Probably something they don't really do too much.
Janice and Josie, how do you both feel about the generalizations like older individuals do not have sex, or your sex drive decreases, or that you're physically unable to do so, or risk of death? Is there any truth to this?
Well, thank you for asking, because I don't think this is discussed enough due to implicit bias from providers. And honestly, feeling embarrassment as an older adult. I feel like as an older adult, I'm misunderstood and therefore left out of the conversation of sexual health. I may be older, but I still have desire for sex and intimacy. I just need help navigating the difficulties and changes that will come with aging, like pain and stiffness from my arthritis, for example, and occasional urine leakage.
And I feel that as an older person, I'm generalized too often. Yes, some older adults are now sexually active and some are very active, but not all older adults are the same. My point is, if older adults want a sex life, they deserve to have the topic discussed and various options available to enjoy that part of their life.
And for both of you, what does a healthy sex life mean?
We've both been together for a long time. I want both of us to feel confident during sex so we're able to have an emotional connection, free from embarrassment. And for me, a healthy sex life means being comfortable. I used to always think that pain during sex was just a part of aging, but I'm learning it doesn't have to be that way.
I think that she said it perfectly. As we get older, we realize that we don't have to be ashamed of issues, and talking through them only makes our relationship stronger.
And this may not apply to you both, but could you tell me about some problems you or your friends have experienced, without naming names?
There's an abundance of physical changes that have occurred as we have aged, and that has made our sexual health difficult. These changes started during menopause, and new changes unfortunately continue to pop up. I know that with some of my friends, vaginal dryness has made sex painful, so they are not really interested in having it. Some of our friends have gotten into different lubricants and seem to enjoy sex way more when using those. Erectile dysfunction is a hot topic among our male friends. They talk about how they see their urologist regularly and are told the symptoms to look out for when it becomes a more serious issue. A lot of them take medication for erectile dysfunction and seem to be doing okay on it, with the stories we always have to hear about it anyways.
Some of us have really been through the ringer. One friend had a mastectomy from breast cancer, another had a prostatectomy from prostate cancer, and all the side effects from meds certainly don't help. But a healthy sex life is still possible. My occasional urine leakage used to be a huge embarrassment for me, but I'm learning that there are options to control it. And as my body has aged, I don't always feel comfortable in it, so that's something I'm trying to accept. I've learned many of my friends feel the same way, and many of us have struggled with depression over all the changes that come with aging. But talking about our struggles with each other, even a professional, has really helped in our recovery from depression to have a healthier sex life.
Another hot topic among our friends group is sexually transmitted infections. The guys tend to act like they are 21 and they are players, which we love to make fun of them for. They say that if they get an STI, they just go get a shot and move on with their day. I do think they should take it a bit more serious than they do, though. The women, on the other hand, tend to be a bit more humiliated when this happens to them. I know that STIs among our age group is significant, though. I've heard that the way women's bodies age and the changes that happen to our vaginas can actually increase our chances for infection.
There are so many ways the older population's sexuality can be affected. In 2017, the National Institute on Aging listed multiple factors, including cardiovascular disease like cardiac function, strokes, and the resulting deficits, behavioral health issues like depression and alcohol use disorder, medications, pain, diabetes, dementia, incontinence, and surgery. Does having any factors like this mean you're sentenced to a remainder of your life without sex? What can this population do to have a healthier sex life?
We feel really uncomfortable talking to our PCP about our sexual health.
Yeah, why do you think that is?
Christina, the Smiths brought up an important issue regarding STI rates among this age group. In 2018, the Centers for Disease Control and Prevention reported a steady incline from 2014 to 2018 of chlamydia, gonorrhea, and both primary and secondary syphilis for those in ages 45 and older. Can you discuss what some of the factors may be leading to this increase and what healthcare change would address this issue?
Well, STIs in the older adults are on the rise. According to the CDC, in the year 2000, there were only 885 reported cases of syphilis in adults ages 45 to 65, but there were more than 2,500 cases in 2010. The rate of HIV in older adults nearly doubled in the same time frame. And it's astonishing to know that the rate of HIV infection in older adults is rapidly increasing in adults over the age of 50, more so than those who are 40 and younger. Physical changes in women's vaginas after menopause can predispose them to an increased risk of infection. Due to the spouse deaths and newfound relationships, older adults are having more sexual partners than before. They are less informed about STIs and safe sex practices such as using condoms. Women don't have to worry about becoming pregnant, so they don't even think about using condoms and such. There are more safe sex practice campaigns geared toward the younger populations than there are for the older. With STIs and HIV on the rise in this population, it is imperative that we educate the older adult about the risks. Hone in on safe sex practices for this age group. That is definitively what is needed.
Janice and Josie, what do you hope will be the one takeaway for anyone watching regarding older adults and sexuality?
I think the biggest thing that everyone should know is that just because we are older adults, that doesn't mean we don't have or want a sex life. It's important that we talk about it so that we can have the right information and precautions we need to ensure we stay healthy and safe. I think that there is a huge stigma around having a healthy sex life as we age, and not a lot of information on how our body changes and how it affects our sex life. I would also like to bring to light same-sex older couples or older adults who go from a heterosexual relationship to a same-sex relationship, and how their family and friends deal with that. Older generations may have more difficulty with this than the younger generations have.
Powerful stuff. Something to think about. Lastly, Christina, could you tell can you tell the viewers what they should be doing to facilitate a dialogue about sexual health? How patients making the discussion transition from a door handle problem to a scheduled office visit for this topic?
Well, good thing you asked. There are many barriers to sexuality. From the healthcare provider's perspective, many may feel embarrassed to discuss this topic with their patients and feel it could be an invasion of privacy. Or they just may think that their patient doesn't have or should not have sex anymore. Many may also feel awkward discussing sex with an older adult who is having relations with individuals 10 to 30 years younger than they are, or if they're in an LGBTQ relationship. Older adults may feel embarrassed as well to discuss their sexuality because they think that they may be dismissed or ignored by their provider if they discuss their sexual orientation or sexual problems with them. It is really imperative for healthcare providers to perform a thorough assessment of their patients. Always focus on the physical, psychological, emotional, social, and spiritual components. Ask them how they define sex. What's their medical history? Do they have any acute or chronic disease processes, medications, or comorbidities that may be prohibiting them from or interfering with their sex life? Ensure them that this is a safe place to discuss their sexuality and that you are there to help and offer guidance. Also, help them to make a care plan that allows them to have sex safely with minimal issues. Discuss their medication, see if there's any changes that need to be made to decrease side effects that are prohibiting them from sex. For example, changing any hypertension medications that could be causing them orthostatic hypotension. Talk to them about sexually transmitted diseases. They need to utilize condoms for safe sex to decrease their risk of potentially acquiring a sexually transmitted disease or HIV. Make them aware that there are options for women to help with vaginal lubrication, such as water-based lubricants or coconut oil. There are treatment options for men as well to help with erectile dysfunction. Also, take time to not only hear the patient, but to listen to what they're saying. Put your own biases aside regarding sexual health and intimacy in the older adult. Start and engage in a conversation about sexual health. Don't wait to be asked. You ask first, and you ask open-ended questions. No question is a dumb question. Don't assume that they are also heterosexual. Be open to talk about their sexual preferences. Focus all of your discussions on safe sex practices, positions that may help to decrease pain and shortness of breath, for instance. Evaluate your patient's goals with every visit. Continue to keep the lines of communication open. Make it easy for them to talk to you about this, as it is as easy to talk about blood sugar or back pain or hypertension.
Thank you. Leah, as you heard, sexual health is not a younger generational activity. Sex is not something someone ages out of when they turn a certain age. These kinds of ideas only perpetuate problems like rising STI rates and present older adults with more barriers. As Christina mentioned, with support coming from all levels, healthcare campaigns targeting the topic may not just address one issue, but the whole gambit that encompasses sexual health for the aging population. Back to you.
If you stuck with us this long over here at 15 minutes, it is our hope that you now understand the significance of sexuality and aging to older adults and the healthcare system as a whole. Sexuality continues throughout the lifespan, and many elderly still enjoy their sexuality late into life. This should become the standard, not the exception. Many myths, assumptions, and incorrect stereotypes pervade today's attitude towards the elderly and their sexuality. There is evidence to demonstrate that sexuality is an important facet of health across the life course, but it is often ignored when caring for the elderly. This breaks the stereotype that aging and the changes associated with it leave one able to have a meaningful sexual relationship with others and themselves. Understanding barriers to sexuality may help nurse practitioners, physicians, PAs give patients realistic and encouraging advice on sexuality. This is a matter that cannot be ignored. Please visit our website to learn more and join us next week for our story on discovering just how stressful graduate school is for a group of nurse practitioner students. See you next Sunday.